Today we're here to mark one of the biggest industrial cases in New South Wales in decades. We are here to commence the beginning of 6 weeks of hearings for an increase to pay and conditions for nurses and midwives across New South Wales. Our union has been campaigning with our members for more than 2 years, and we're now in a situation where we're seeing a final outcome being decided by the Commission. We're confident that we have brought forward the strongest possible case to deliver a real pay rise that will really value the incredible work that nurses and midwives do in this state, and will be a real investment in the healthcare system here in this state. We know that the evidence today will go to 4 main areas. It will talk to the increase in work intensification or work value. We'll also be dealing with evidence that relates to recruitment and retention challenges because of the wage freeze that we've experienced for many years and the wage suppression. And also evidence will be led in relation to productivity. We look forward to seeing the outcome of this evidence. We've put forward a strong case with a number of excellent expert witnesses, and also the incredible witness evidence of our members who can talk to how challenging their work is every day, but how vital that work is. And we look forward to seeing a decision made by this full bench of the Industrial Relations Commission. So our members voted to accept an interim pay offer recently. That was a 3% increase to their wages. This case will deal with a much larger claim and a whole range of vast evidence, as I touched on earlier. What will ultimately happen is any decision that comes out from the Commission, that interim 3% that was accepted will be discounted from any final offer or any final decision, that's put forward by the Commission. We have put forward our best foot forward, frankly. We've put forward compelling evidence. We believe that there is a very strong case to be had about historic undervaluing of nurses and midwives. We believe that nurses and midwives have always been undervalued in relation to the contribution of their work. We believe that this case will present the best opportunity for nurses and midwives to receive a proper and fair pay increase, but importantly, a pay increase that keeps our wages competitive here in New South Wales. We know at the moment they're not, and so it's unfortunate that we're in this situation. We wanted to seek a settlement with the government, but we've been pushed to a position where we are now having to run this case. So we hope that this case presents an opportunity to finally see nurses and midwives recognised. The decision here will be final. We're within the life of our current agreement. So this will be the ultimate decision that all parties have to live with. So currently New South Wales sits in some of the lowest pay across the country. We've got first year nurses currently paid around $72,000. That's about 18% behind Queensland, and that's driving some real issues with retention and attraction, particularly in our border towns. So where we've got Queensland, Victoria and ACT all paying far more competitive wages to New South Wales, it's making it very difficult for us to maintain services and to attract nurses and midwives to want to work in this state.
That I'm a 30-year veteran of working in New South Wales Health, and I've seen the conditions deteriorate over that time. The staffing is short-staffed, many shifts, and we're seeing a real change in our work intensity, the technology that we're having to master to deliver care to our patients. And our patients are older, sicker, have more comorbidities or chronic illnesses, and they're much more complex than they were when I first started out. So I'm seeing a real change in what we're dealing with as nurses and midwives, and I'm very concerned for the future. I think the community is supportive of nurses and midwives. They know that we're vital to their life. They know that nurses and midwives deliver quality care every day despite the challenges that we face. And I think the community really wants to support us. Personally, I'm very excited for this. I know that as a member and our union have put in a lot of work for this, and it's come to this point. We know that we're on the right side of history, and we're really hoping that we're going to have some significant gains. And I'm sure I speak for the members here today, and also for my colleagues who are hard at work right now. We're all hoping for significant gains for our profession.